Hey guys, it's Ashton here for Support Your Brothers for our How To Sunday. This Sunday we're going to be talking about top surgery. We got a question about top surgery and like cost related things, so I figure it's easier to go into depth in a video than an answer for the question. So some tips that I would have for top surgery right away would be to start a fundraiser either through like GoFundMe or You Caring, and start spreading the word about it. Even if you haven't had a date, you can still start spreading the word because then at least you're getting it out to people. Tell your family about it, and if you get donations, that's less money that you have to take directly out of your pocket. So that's also going to benefit you in the long run. Second tip would be to start saving early. I started saving right away after I saw the first surgeon. But I would even start saving earlier than that. Like if you know you want top surgery, start saving right away. The sooner you start saving, the more money you're going to be able to save up, and you won't be in such a panic towards the end to get all the funding. And if you start saving, that can save you going through like care credit. And I know care credit's a really good thing, but their interest rates are super high, and that's how they're going to make a lot more money off of you than if you just start saving early. So while care credit's a viable option, you're going to want to save up as much as possible so you're not getting hit with a high interest rate. Third tip I have would be to do research. If you check out our resources page, we have a couple of links to help find top surgeons. I know that I used one of the links that's on there, and it listed a bunch of well-known surgeons, and I kind of just went through each one and looked at like their websites, looked at patients' results, read up on how much they cost, what type of procedures they offer. So you're going to want to research, and you're going to want to take a lot of time to research to find somebody that to find a doctor that you really want to go to. When you're researching, look up doctors that are well-known doctors like Dr. Garamoni, Dr. Medali, who I'm actually going to see. I went and talked to Dr. King in Madison. There's a guy I know in Chicago. There's a really good doctor in Plano, Texas. I've seen his results, and they're really good. So there are doctors all over the place that perform the procedure. So I would just find one, whether they're close to you, whether you like their results the best, and then go from there. I would also saying that when you're looking at doctors, look at some of them will have like their patients' results posted. You're definitely going to want to check those out because those are going to give you like a general idea of what your chest is going to look like after surgery. Granted, it's not going to look exactly like that because everybody's body is different, everybody heals differently, but those can give you a really good idea of what you can kind of sort of expect your results to be, depending on procedures too. A lot of doctors offer like either keyhole, peri, or double incision. So make sure you definitely check out those based on the procedure that you want. And then, obviously, that being said, you're going to want to look at the different procedures that they offer. Do they solely do a double incision? Do they offer a peri option? Do they offer a keyhole option? Depending on how big your chest is, you can go with like a keyhole and a peri, and then you won't have the big scars, or you can just go with a straight up double incision if you want a fresh start, flat chest. But that's personal preference too. Some surgeons will tell you, like I am going to see Dr. Medali, and he told me that I was on the borderline, so he needs to meet me in person to decide whether we're going to do a peri or a double. So if you're on the border, that could happen. It depends on what you want, and you're going to want to go to the doctor that can give you great results and do the procedure that you want. Sometimes, though, they will advise against it, the procedure that you want. So, like, when I went and saw Dr. King, he told me that I'm a really good candidate for the peri, but then when I saw Dr. Medali, he was like, you're on the borderline, so this is kind of what we would do. So it depends also on what they say. Obviously, I trust their opinions because they know better than I. They've been doing this for years, and I'm just like, oh, this is a procedure that I want because I don't want the scarring. But I've decided, that like if it comes down to it, I will take the scars because in the end, I still will have top surgery and I will feel a lot more comfortable. Um, Also, look at the prices. The prices are going to vary from surgeon to surgeon. So if you kind of have an idea of how much you want to spend, um, look at the prices. Usually they give you kind of like a general quoted range, and then when you go in for a consultation, they give you like a more specific range. So I would just get like a general idea. Most of the surgeons' quotes on their website, like their general quotes, are true to price. But if you're wondering, you can always email their office. I emailed a couple of offices about like different surgeons' quotes. Some people responded, and some people did not, and that also kind of can you can take that into consideration when deciding, because a lot of times, like if they're not answering, it's either they're really busy or that's not someplace where you're gonna want to go. And then I would look at if there are any reviews out there about the surgeon. I would read over the reviews. It's going to give you a good idea of how they handle their patient care and stuff like that. Most of the doctors that I read up on, everybody was happy, everybody was thrilled, their staff was really nice. So usually that's not a problem, but you still want to read those reviews. It's going to give you an idea of who you want to go to and stuff like that. And then once you do some research, when you're researching though, I suggest taking a lot of time, just because this is a big procedure and you want to make sure that you're getting the results that you want. So take the time to research, take the time to look over things. It's okay if it takes you a couple months to research before you schedule even a consultation. You don't want it. This is not something that you just want to jump in on and be like, oh, I found a doctor, that's who I want to go to, because there are different options, and you want to make sure that you're going to the person that's going to give you the best results and the person that you feel most comfortable with. So then obviously after you do your research, pick a doctor and then start taking steps from there. Schedule a consultation with them. See how much they'll give you, like a price quote. They'll tell you what procedure they're going to do. They'll give you financing options, so like the care credit and stuff like that. If they take your insurance and your insurance covers it, you can work with them to do that. And then you obviously just set up a date and you go from there, and you continue to save up until your surgery date or whenever they want you to pay for it by. An extra tip, like an optional tip that I have, would be to get a second opinion, just because some doctors are more expensive than others. Like, I first went in with a consultation for Dr. King, and he quoted me like $9,300 for the procedure, and I was kind of like, okay, that's the amount I'm gonna have to pay. And then I talked to my dad like on the way home from the consultation. He was like, I really think you should get a second opinion. I think he quoted you kind of high. You could probably find a lower price. So then I ended up doing a second opinion with Medallion in Cleveland, and his pricing was a lot lower. So sometimes I know that it costs money. I just used part of what I had saved up for the consultation with Medallion, and his was only like $65. So if you can, try to get a second opinion. I'm not saying that you have to. It's just a tip and an optional tip that I'm throwing out there. I'm glad I got a second opinion because I am going to end up paying less for my top surgery than I initially thought I would. So that also helps you readjust kind of your savings and stuff like that. As always, feel free to contact us on our blog. I'll put in the link If you want to have a more private conversation, feel free to shoot us an email. We try to respond as best we can. Life gets busy sometimes. Like this week, I have had school has been kicking my ass, so I haven't really been on social media. But we'll get back to you as soon as we can. Feel free to leave comments, ask more questions, send us video ideas, topics that you want us to cover in future videos. We're always looking for those, so we can keep this day going. And as always, I hope this helped, and enjoy your Sunday, guys.